There's something your loved one may be trying to tell you, without saying a word. Have you ever looked back and realized the signs were there all along? That gentle weight loss, the quiet fatigue, the way your loved one seemed a little more distant than usual. Most of us think that when someone passes in old age, it happens suddenly. But the truth? The body often whispers long before it stops. These changes, soft, slow, and easy to dismiss, can begin months, even a year, before the end. And because they seem like just part of getting older, families often miss the chance to truly prepare, not just practically, but emotionally, too. This video isn't here to scare you. It's here to gently open your eyes. Because when you understand what to look for, you can hold on tighter to the moments that matter. In the next few minutes, I'll walk you through 5 quiet but powerful signs that often appear in the final year of life. And by the end, you may see things a little differently, not with fear, but with love, clarity, and presence. Have you ever looked at a loved one and thought, they just don't look quite the same lately? Maybe their clothes seem looser. Maybe they're skipping meals more often. Or maybe they say they're not hungry, but deep down, you know something's changed. One of the earliest and most overlooked signs that the body is slowing down is unintentional weight loss. It's not just about numbers on a scale, it's about what the body is trying to tell us. And often, that message is, I'm preparing for something deeper. Take my Aunt Helen. She loved cheesecake all her life. But in her final year, she'd just smile and say, maybe later. That moment still stays with me. At first, it can be subtle, a belt notch tighter, pants that don't quite fit the way they used to. Families might brush it off as just part of aging. But behind the scenes, the body could be struggling. Nutrients aren't absorbed as well. Muscle starts wasting away because protein isn't being processed properly. And if there's an underlying condition, like cancer, heart failure, or kidney issues, it might already be quietly progressing. Even emotional and mental health play a role. Depression, loneliness, or early cognitive decline can reduce appetite without anyone noticing right away. So, what do? Naturally, we try to fix it. We bring their favorite meals, protein shakes, snacks they used to love. But sometimes, nothing works. And that's when we need to pause and listen. Because this might not be about food at all. It might be about the body transitioning into its final stage. In these moments, it's not about forcing one more bite. It's about comfort, easy-to-eat meals, sips of water, foods that feel gentle. It's about being present, not just in action, but in understanding. If you notice a loved one losing weight without trying, eating less, or feeling weaker by the day, don't ignore it. It might be the body's quiet way of asking for care, not correction. Because sometimes, the kindest thing we can do isn't to fix, but simply to accompany. Have you noticed your loved one sleeping more lately? Maybe they used to enjoy cooking or chatting on the porch. But now, even getting out of bed seems like too much. This isn't just being tired. This is something deeper. In the final phase of life, extreme fatigue can set in, and it's a kind that rest can't fix. It's not about needing a nap. It's about the body slowly redirecting energy away from daily tasks and toward basic survival. Every movement, walking to the kitchen, brushing their hair, even holding a conversation, can start to feel like climbing a hill with no end. Why does this happen? The answer lies in the body's quiet retreat. As organs begin to slow down, circulation weakens, and muscles receive less oxygen. The heart doesn't pump as powerfully. The body, ever wise, begins to conserve energy. It's as if it knows time is precious, and it focuses only on what's essential. But the fatigue doesn't stop at the physical. It begins to shape emotions. 2. A once independent parent might feel embarrassed they can't do simple things anymore. They may withdraw, avoid visitors, or stop engaging in hobbies, not because they don't care, but because they simply don't have the strength. This shift can be hard to witness. You may find yourself wondering, should I encourage them to be more active? Should I push them a little? The truth is, this isn't about motivation. It's about honoring where they are. What they need most in this stage isn't pressure, it's peace. A quiet space, a warm blanket, a hand to hold, without expectations. If your loved one seems more exhausted than usual, take it as a gentle message from their body. Be there, Sit in silence if you must. Let them know it's okay to rest. Because what matters most isn't what they can still do, but that they feel loved and accepted. Just as they are. Sometimes, it starts with something small. They forget where they placed the remote. Or they call you by another name. Just for a second. At first, it feels like the usual, senior moments, we all laugh about. But over time, the forgetfulness deepens, and the laughter fades. When someone is nearing the final stage of life, the mind begins to drift in quiet, unexpected ways. Conversations become harder to follow. Familiar routines feel confusing. They may repeat themselves, forget names, or become disoriented, even in their own home. This isn't just normal aging. As blood flow to the brain slows, the brain starts to wind down. Thoughts become cloudy. Decision-making becomes difficult. Sometimes they seem lucid, then lost, within minutes. Emotionally, this withdrawal can be quiet and gentle. You might find them sitting for long stretches, staring out the window, not sad, not upset, just somewhere else. And it's easy to take this personally, to feel like they're pulling away. But what's really happening is that their inner world is becoming quieter, and it takes all their energy just to stay with us. Some become more irritable, others unusually calm. These shifts are the brain's way of coping with decline. How do we respond? Not with correction, not with frustration, but with presence. Speak gently, sit beside them, hold their hand, even when the words don't come easily. Your presence still reaches them. They may not remember the conversation, but they'll remember how it felt. Because in these moments, connection doesn't need to be spoken. It just needs to be felt. Have you noticed your loved one getting sick more often than they used to? Maybe it's a cough that lingers for weeks, a UTI that keeps coming back, or a small scratch that just won't heal. At first, it might seem like bad luck or a passing cold, but over time, it becomes clear. Something deeper is changing. As the body enters its final chapter, the immune system begins to slow down. What used to be minor, a bruise, a sniffle, can now linger or become dangerous. Even antibiotics might not work as they once did. But here's what's tricky. The signs of infection in older adults aren't always obvious. Instead of a high fever, they might just seem more tired than usual. Instead of pain, they may lose their appetite or become confused. These subtle shifts can be the body's quiet call for help. At this stage, gentle care matters more than hospital beds and IV drips. Clean skin, hydration, calm environments, loving presence. So if you notice repeated infections, or wounds that won't heal, don't just focus on fighting. Focus on soothing. Because sometimes, what a fading body needs most is peace, not pressure. There's something deeply emotional about watching someone you love breathe. It's one of those quiet rhythms we take for granted until it begins to change. In the final stretch of life, one of the most noticeable and tender shifts is in how a person breathes. You might hear long pauses between breaths, or a rhythm that speeds up, then slows down. Some experience Shane Stokes breathing, a pattern of deep breaths followed by silence. It's not a sign to panic. It's the body finding its rhythm between effort and rest. Other signs often follow: cold hands and feet, mottled skin, not because they're cold, but because the body is conserving its last bits of energy. Even small movements might cause shortness of breath. You may find them sleeping upright, needing more pillows, preferring a recliner. And while it's tempting to do something, what's truly needed is calm. Soft music, cool air, a quiet room. Because this is the body's way of letting go, and our role is not to fix, but to accompany. We've talked about 5 signs, quiet but powerful reminders that the body is preparing for its final transition. They don't always come all at once. They may be easy to miss. But when we notice them, we're given a gift, the chance to shift from fear to presence. Instead of rushing, we can slow down. Instead of fixing, we can cherish. And instead of denying what's happening, we can honor it with softness, honesty, and love. You can't stop what's coming, but you can choose how to walk beside them. This is the time to be there, not just as a caregiver, but as a companion, to fill the final chapter with stories, warmth, and dignity. And remember, you are not alone in this journey. Before we end, I want to invite you to take just one small step. If this video spoke to you, please share a memory, a name, or a small story in the comments. Your words might be the exact comfort someone else needs today. If you found this video helpful, click the like button, not just for the algorithm, but to help this message reach others walking a similar path. And if you'd like to receive more gentle, thoughtful videos like this, subscribe and turn on the bell. You'll always have a place here with us. Thank you for watching. Thank you for caring. And most of all, thank you for showing up with love.